Just stand here and everybody quiet it down. That gives me a sense of power. Good evening, everyone. I am Ida Castro. I'm with the Geisinger Commonwealth School of Medicine, but tonight I'm here very pleased and honored to be asked to MC this wonderful event. On behalf of the Interdependence Day Planning Committee and sponsors, we welcome you to this 2017 Interdependence Day celebration. During the past few weeks, we have witnessed the devastation created by two Category 5 hurricanes, wildfires, earthquakes killing more than 2,500 people in Nepal and over 100 in Mexico. Closer to home, both Harvey and Irma have given us a reminder of how we are connected to nature, to our friends, family, and fellow human beings. From the tinier islands in the Caribbean to the largest cities such as Houston, San Juan, and Miami, we witness people helping each other, depending on each other for their survival and ultimate well-being. As these communities, shocked by devastation, seek to rebuild, many will suffer from emotional and physical ailments resulting from these experiences. Although in this area we have been saved from the impact of these particularly devastating natural events, we too experience shared concerns regarding the health and well-being of our family, our friends, and our neighbors. Indeed, it is in time of distress caused by nature or caused by man that we realize how important our interdependence to others, how crucial a strong network of friends, family, neighbors, and caretakers is to our ultimate goal of being and remaining well and healthy. So today we have a wonderful program for you to help us further reflect on this important reality of interdependence. But before we proceed, I would like to call upon someone who all of you probably know and requires no introduction, but I will definitely give his title and his name. I'd like you to welcome Mayor William Courtright.
All right.
Who has an important message for us. Mayor?
Thank you.
You're welcome.
I got to take my glasses off to read. So first, let me say, hi Mayor, how are you? I'm thrilled to be here and honored to be here. And I just want to say welcome to all of you that are new to our area, because we welcome you all. I have a proclamation here that I would like to present to you on behalf of the city of Scranton. So if you could bear with me for a minute, I'd like to read it to you. Whereas the inaugural Independence Day was launched on September 12, 2003 in Philadelphia to focus attention on the fact that interdependence is not an ideal, but a reality. And whereas today, September 12, 2017, has been declared Interdependence Day in the city of Scranton in collaboration with celebrations at home and abroad. And whereas this year's local theme, Interdependence, a medical perspective, strikes a special chord, reminding us that affordable health care is a national priority. And whereas our purpose is to acknowledge that the 21st century world is a world without borders, in which people from towns, counties, cities, states, and nations depend on one another for support in all of our endeavors. And whereas we must commit ourselves to creating a more inclusive society and embracing the idea that healthcare is a human right. Now, therefore, I, William L. Courtright, Mayor of the City of Scranton, do hereby proclaim September 12, 2017 as Interdependence Day in the City of Scranton. And I urge all citizens to embrace the concepts and the spirit of Interdependence Day. At this critical junction, we must realize our success as a community depends on our coming together for the good of all. Thank you.
Thank you so much.
Nice to see you.
Thank you so much.
Take a picture. There you go.
There you
Maybe
go.
Sandra, do you want to come up here?
Come on,
Yeah.
Sandra. Join the photo op.
Okay.
Un momento, por favor.
Oh, there you go.
One more.
Oh,
That's okay.
come on, Ida.
Thank you. All right.
Thank you so much.
Thank you, Mr. Mayor. Yep.
What, you say?
I'll do it. Okay. We got it. So I would certainly be remiss if I didn't use the privilege of being at the mic to give a very important shout out to people who are very important to me. So I have my boss right in the back, Dean Scheinman from the School of Medicine. I have faculty members from the School of Medicine. Can faculty please stand up? And more important than all those people are the students. Can the students from the School of Medicine please stand up? All right. Thank you for being here, all of you. And now it is my distinct pleasure to introduce someone who led the effort to begin and continue the celebration of Interdependence. She, as you all know, because you all know her, contributes to our own well-being with her insight, her advocacy, and very importantly, her kindness. So for me, it is indeed an honor and a pleasure to introduce to you Sandra Myers.
Thank you. Thank you all for being here. Wow, the room is full and the Scranton is behind us and looks beautiful from here. As we celebrate the 14th Interdependence Day, I am overwhelmed by memories of the beginnings and the challenges that still remain in persuading people in their neighborhoods, their towns, and their nations that interdependence is a reality. Our goal in establishing the day was to call people to order to remind them of the moral implications of that reality. What do we owe our neighbors and our professional associates and even strangers? And what does our nation owe to its neighbors and allies, and yes, even its enemies? I co-founded this day with a man with whom I had been working for several years, Benjamin Barber, a brilliant political theorist who helped me to understand the anatomy, or one could say the architecture of democracy, was all hell-bent on trying to get people to discover their interdependence. And so, thinking about the impact of Earth Day on the environmental movement, this, by way, being soon after 9/11, we decided to create an Interdependence Day and to celebrate the day after 9/11, our interdependence on September 12th, which is today. And so here we are. Unfortunately, Ben Barber died earlier this year after a short battle with pancreatic cancer. But he was passionate about keeping this day of reflection alive, and we will continue to do that here in Scranton. A few weeks ago, engaged in a project focused on the relationship of public education to our American democracy, I turned to the venerable American philosopher John Dewey, who referred to the principles of Friedrich Froebel, a German educationist of the early 19th century. His first principle was that the primary business of school is to train children in cooperative and mutually helpful living, to foster in them the consciousness of mutual interdependence, and to help them practically in making the adjustment that will carry the spirit into overt deeds. Some of us may have or may not have got that spirit in kindergarten, where Froebel intended it to be taught. But it's never too late, in the name of civic responsibility and civility, to embrace the interdependence that is our reality. Thank you.
And now we have a special treat. Our guest speaker is someone who is not a stranger to this area. She first arrived to NEPA when her husband completed his residency at the Wright Center. Although she returned to India, the connection to NEPA just drew her right back to the area to complete her own residency training in internal medicine, which she did in 2013. Today, she is back at the Wright Center, this time as a provider and medical director for the Wright Center for Primary Care in Mid-Valley. She's here, I see, with her beautiful 2 children. Dr. Jumi Barua is actively involved in research, quality improvement, and educational initiatives. Tonight, she will share with us her perspective on the relationship, the medical perspective, and interdependence, and begin a very important conversation. So please give a warm welcome to Dr. Barua.
Welcome everyone. First of all, I would like to thank Ms. Sandra Mayers for giving me this opportunity to share my story as an immigrant and how we integrate interdependence in our medical community. I am Jumi Barua, as my introduction was already given. I grew up in the northeastern region of India, the green state of Assam. As some of you may know, famous for its famous Assam tea. I'm currently serving this community as an internal medicine provider, resident faculty, and medical director of the Wright Center Clinic in Germany. I grew up and went to medical school in Assam, and me and my husband, Pranjal, were working there in a tertiary care center. We had just started our family with Dhruv, the joy of our life. We started talking about moving to the US. I guess the big question is, why did we do that? We wanted to practice medicine in a best practice center, where the guidelines of our profession are written, where there are resources to practice medicine the way it's meant to be, not limited by lack of medicines or equipments. I still remember, like it was just yesterday, when I received a call from Pranjal. He was visiting his brother in Boston and was interviewing for a residency position in Scranton, Pennsylvania. He told me he has been offered a position, and in his words, "I know you will love it. This place looks just like home." What he meant were the hills and the greenery, because I am from the northeastern region of India at the foothills of the Himalayas, green, beautiful, just like Scranton. And that started our transatlantic journey. Now that I think back, was it a difficult move? Was it a very difficult decision for us? Not really. It was certainly a very tough decision emotionally. We come from very close-knit families, and now we are thousands of miles away. We are fortunate that we have family visit, and we try and go back to visit them. Right now in our midst, I have my 2 favorite aunts sitting in the audience, and I'm so lucky to have them here. Culturally, I am not from a conservative background. I went to a school where we were taught to embrace all religious beliefs. As a preschooler, I still remember my dad telling me God resides in everyone's heart and all places of worship, be it a temple, a church, or a mosque. I grew up celebrating different religions and holidays. India is a country of festivals. We have different pujas, Diwali, the festival of light, Holi, the festival of color, Eid, Christmas. We celebrated everything. The reason I put up these 2 pictures, obviously the first one is of my husband and me with Dhruv. The other 2, the reason I put them up was me standing there in my traditional attire is actually at the Abington Library here, presenting on India. But the one with me and Pranjal, along with my aunt here, with a Christmas tree at the background, is a picture from India before we moved.
Very nice.
India is a secular country with different cultures, religions flourish there. and have done so for centuries. So coming to the US, it was very easy for me to understand and blend into society here. The diversity of US society reminds me of India's secularism. The idea is the same, with diverse religion and ethnicity. However, professionally, this is where globalization really comes in. Guess what? Diseases, ailments, for the most part, are the same. Resources are more plentiful here. The system is different, the level of sophistication is different, but the key is to be patient-centered, and medicine is the same. It's about treating people, it's about being patient-centered. Here, my very special thanks to Dr. Linda Thomas Hemmock for her guidance and support and being my mentor. This relationship started with her being my physician when I was pregnant with my younger daughter, Kritika. Then through my training and my first job, she always believed in me and nurtured me and helped me. So a big thank you to you. I am very proud to be a part of the Wright Center. The Wright Center, although sometimes misperceived, is intentionally diverse. We are proud to have had residents from 33 different countries. Currently, we have residents from 17 countries around the globe. We have globally diverse teaching, medical professionals serving an Anglo-Saxon Italian community here in Scranton. With the help of Ki Chi, originally from China, we have developed our Asian medical home, which is in downtown Scranton, to help natives from different countries. Recently, we looked into our internal resources, and this is fascinating. We had this young boy, a 2-year-old kid, who we realized had increased lead levels in his blood. We were trying to convey this message to his parents, who speak Nepalese, which is the language of Nepal, another Asian country. We looked into our internal resources, and guess what? We had a resident in our 3rd year who is from Nepal. So we reached out to her. She was working at a different, in a different location at that time, like within the system. But we had her over phone when the patient and when the little boy came with his parents, and it went smoothly. The message was conveyed, and we got to take care of him. So very powerful, very, very powerful. So this is actually a picture from a gathering we had here in May this summer, and where our residents and faculty had a chance to share culture and cuisine from various different countries. So this is the 33 different countries from where, we have had residents throughout the years. Also, perception is very important. It affects us all. Most of the time we fail to see this as we look at only one side of the picture. Let me tell you a story of how it affected me at our clinic sometime in the earlier part of this year. For this, I kind of need to tell you how our clinic functions. We have residents in training. So they go into a patient room, they speak to the patient, talk to them about what's going on, and then come to us as the preceptors to kind of present and tell us what's going on, why are they here today, and we go back together. This resident, she comes out, she tells me about the patient, we go in together. I go in to see a middle-aged white male patient, and I was very taken aback by his questioning. He looks at me and asks me, "What nationality are you from?" I'm like, "I'm from India." "Are you Muslim?" I'm like, "No, I am not." And then he looks at my learner, but she is. So then I look back at him with a questioning look. I'm like, "So?" And that was kind of the end of the conversation. We did not really venture further into it. It really gnawed at me, it did. So that was over a weekend. So the next day, I discussed with his regular provider, the doctor who takes care of him like every day and who really knows him. What I realized was this gentleman is very inquisitive. He has served in war in the Middle East. He loves to ask questions and he loves to chat. He loves to know who's from where, what's going on in their lives. His inquisitiveness was misperceived by me as poor acceptance. And this can happen to anyone. It was a great learning point for all of us there. Another incident that occurred at the Veterans Hospital, where our residents do go for training. A resident trainee speaking in his Arabic national tongue precipitated a post-traumatic stress disorder in one of our veterans. So it can go anyway, but these are all teaching points for us. We learn from them as we grow. Whether we want to accept it or not, demographics are really changing. There is a need for education of our community at large. And thank God for the likes of Sandra Mayer for standing up to that challenge. Now, another big question. How does this impact healthcare and how can we work towards changing it? We relocated thinking we were merging into a system that is near perfect. But is it? As humans, we all strive to improve ourselves. Medical science has progressed in leaps and bounds, but the system, it does have its flaws. There is really no silver bullet on the horizon. Healthcare costs us, our families, our friends, and our children. 34% of healthcare costs are waste, and 1/5 of our total economic output is spent on healthcare. We together must innovate for value. We should work together towards our quadruple aim: patient experience, cost of care, population health, to ultimately be joyful for everyone. How will this happen? Will someone make this happen? Will someone make these changes? What if all of us are waiting for someone to do it? We together got to do it. We at the Right Center are trying to make small changes which we believed, if done right, can make an impact. Our system improvement is based on PDSAs, which is the system of plan, do, study, and act. We do it ourselves. We teach our employees. Last year alone, we registered 830 PDSAs, 70% of which were completed. This year, so far, till date, we have 2,179, 1,585 completed and 473 in progress. There are successful PDSAs from which we learn, and more importantly, there are failed PDSAs. But every single one of them has value to it. We learn from it. Our graduating learners and residents go and work in different states in the country. We hope that they will continue to perpetuate the change. That's our mission. We identified big deficiencies in our society internally in terms of behavioral health and addiction medicine. And this involves the American health system. Our community came together recognizing the evolving mental health problem and donating towards it. Our behavioral healthcare initiative, helped by our partners, the All One Foundation, the Scranton Counseling Center, Geisinger CMC, we are all working towards a common goal. Recognizing this challenge in our healthcare in terms of want of our need for mental health providers led us to develop the psych residency program. These are our first residents who have enrolled in the residency program. We are blessed by our partners, and Dr. Chandragiri has volunteered to be the program director for this program. These are the smiling faces of all our first-year residents, and the first one is Alex. He's a graduate of the Geisinger School of Medicine, as maybe some of you already know him. He is now a pioneer of this residency program, and we hope to nurture him so that there is payback to the community. That's our goal. Our healthcare delivery system is fragmented and siloed. Insurance companies are paying for wrong value care. Did paid seekers going to our emergency rooms, our offices, our specialists nationwide for a prescription of narcotics generate this national epidemic of prescription, non-prescription drug use, overuse, and death? We cannot ignore this. This is us. We are part of the community. We live, work, breathe here. So does our family, our friends, our children. So let's pledge. I'll be part of the solution to the opioid crisis in response to the Surgeon General. We at the Right Center started our COE, which is our Center of Excellence program, to combat addiction. Our force is our resident trainees, who will have the opportunity to carry their training far and wide. This is led by all our faculty, and sitting here we have our Behavioral Health Director, Scott Constantini. This is us in practice at our clinic with Dr. Jignesh Sheth taking care of our patients. We also use IT to wire a culture of interdependence. We have our safe reporting system, which is a tool which every employee uses. Every employee in our system are our eyes and ears. The common aim is system improvement. This is linked to our system of PDSAs. So whenever we identify a problem, we try to run a PDSA, try to make some changes, and take it from there. Now this is, when I heard the term interdependence from Ms. Mayers, it intrigued me. The following week I was in Phoenix and I watched a video of a flight of a monarch butterfly in a butterfly museum. I thought, insects, birds captured this a long time ago. It is sad that we as humans, supposed to be the most intelligent being on this earth, we are still struggling with it. Or are we? We see it. We are always a part of it. Then why do we hesitate to embrace it? Interdependence is not a wish or an ideal. It is a reality. Even from ancient times, there were seafarers. The Silk Route trade. Just like no region of the world is self-sufficient, no person on this earth can survive alone. The world today is a global village. We just need to embrace it. So let's hold hands and jump in. The more, the merrier. And make the world a better place for us and our children. My special thanks to my Right Center family for making all this happen, and Jen Hatro, our Director of Communications, for actually preparing all the slides for me. And in the midst of my planning all this, every Friday, I have the opportunity to go through my little one's folder, which is called her Friday folder, whatever she has done in school during the week. And this is what she brings home. Why does she, I'm sorry, this didn't really come out very well, but why does she think she's a wonder? She thinks that I'm a wonder because my whole family was born in India, but I was born here. I had to put it up there.
She's not playing something. You guys can go.
Thanks for this opportunity to share my story.
It's very good. She's doing very well. This was very interesting. I have some friends who are from India, and they said when they first came here, the gentleman who was the Indian, he had a lot of problems with people saying, you're not from here, blah, blah, blah. This was 40 years ago. And he met an American, and she helped him get through it, and he's a very successful person. He's doing great. And I'm very happy to hear you guys do very well too, and I'm happy for you.
Thank you.
You're very cute. Adorable children you have. They're really nice. Anybody have a question?
Yeah.
No question?
Are all the residents graduates of medical schools in the United States?
or do they come from medical schools in other countries?
In our residency program,
Yeah.
yeah, we do have residents from the US and also from a lot of what we call the international medical graduates, the IMGs. We have a good percentage of that. And like I said, like we have been fortunate enough to have residents from 33 different countries worldwide. And currently we have nationals from 17 different countries. Yeah, yeah.
Can you give us your observations on the quality and emphasis of medical training in India versus the United States?
Yeah, I mean, the one thing that we kind of, the books are the same, medical literature is the same. Now with internet access, like, but what I learned, like practically when we were there, I guess our biggest frustration was the availability of resources. We knew what to do. We studied in our books. We knew what we can do to test a person, to kind of maybe help treat, but then we are very limited by our resources. I know it's getting better. It's getting much better. And I was fortunate enough to actually train in, now most of the medical colleges or medical training venues in India are funded by the government. So a lot of funding come from them, and they mostly serve our underserved or underprivileged population. So it was it was a great perspective. It was a great learning venue, but we were often limited by our resources, what was available to us.
Do you have the same undergraduate requirements?
Yes, the undergraduate requirements are the same. So I did internal medicine residency in 2 venues. Like I did medical school in India, and like I initially said, like we were really settling down there. So I did my IM residency in India. We completed that, and I was actually practicing there when we decided to relocate. So when I did my internal medicine residency here in Scranton, the biggest difference I found was in the system, how the system worked. There it was much more fragmented care, in the sense that, when people are really sick, they would come to the hospital, we would take care of them, fortunately get them, hopefully, get them better and get them home. But there was very little follow-up. They didn't have the resource. Sometimes they would travel like, a long distance, 5-6 hours to come to the hospital to be treated if they were really sick. We often found a lot of patients ending up in our emergency rooms there who are actually in coma because they waited that long to get to care. Because it's a lot of expenditure to even book a bus ticket or bring someone home, rent a car, bring someone home, and then once they go back home, there's very little follow-up. There was also very less involvement with integration of behavioral health, integration of social workers, pharmacy, like the different disciplines you find here, working together to make it a better, better system. Definitely, yeah.
Is it getting better? In India, is it improving?
It definitely is. It definitely is. Things are definitely getting better. And I'm talking about my training in, like I said, a government medical college where most of our patients were the underprivileged population who really didn't have access to good health care.
I'm glad you do that.
Yeah.
What would you say is your greatest satisfaction and your greatest frustration with U.S. Medical care and the whole system?
My greatest satisfaction, I have to say, is seeing the integration of the different services, the different service lines, and how we really, and the preventative aspect of medicine. Like prevention, we always know is much better than cure. So that aspect, like when I was in India, it was all about hospital care, taking care of really sick patients. I really got interested in outpatient medical care after I came here. Right now, that's what I love to do the most. Having my, long-term relationship with patients, developing care, and kind of trying and prevent and getting screenings done rather than going in for treatment, if we can avoid that. My greatest frustration, I have to say, is the healthcare system as a whole in terms of how the insurance, the pays, yeah, that aspect of it.
Earlier you mentioned that something in the U.S. that really resonated with you was the patient-centered approach to medicine.
Uh-huh.
Can you elaborate on what patient-centered means to you as a physician?
Uh-huh. So I'm very fortunate to be working in the patient-centered medical home. We have been actually recognized as a level 3 patient-centered medical home, which is the highest level, which is kind of taking care of patients as a whole. I mean, it's not fragmented care, like I said. It's about more preventative care. It's you come in to me, like I have a cough or I have a cold. I'm looking at that aspect of it, but I'm also at the same time trying to resonate with, did you get your screenings done? Did you get your mammogram done? Did you get your shots? Like the whole entire, like a healthy individual rather than a sick visit.
Do your international medical students plan on staying in the United States, or it all depends on what happens when they finish?
I guess it depends on, but most people, like if you have already made the decision to move so far away from home, I think most people do move with the intention of staying and serving the community. Me personally, I have really seen very few people decide to go back, and if so, it's usually because of family reasons, family ties, something changing, because it's a big move.
Oh,
Yeah, yeah.
Doctor, I've read where criticism of the American healthcare system, one criticism is that it's too top-heavy on the specialty medicine, and there should be more emphasis on primary care. And the way it's going, I mean, you brought up the chart and everything, and of course everybody's aware now, about it's reaching a crisis. I think in the country, like how do we pay for all this? I was wondering what your perspective is on that in terms of the primary. Could we save money? Could we improve the value of healthcare by focusing more on primary care? I guess that's what my question is.
Yeah, like I am definitely a primary care physician at heart. I would say yes, if we take good care of our patients, if we take good care of our population at large, and it's not being a patient, it's about coming in for your well checks, giving the preventative care. I think we could prevent many of our ER visits and specialty visits. Obviously, if there's a need, that's why we have our partners, that's why we have our subspecialists to help us out. But really, we should be looking at, in our offices, knowing the person, really getting to know the person, so that when someone comes to you, like, oh, I have been seeing Mr. So-and-so or Miss So-and-so for several years. I know what's going on. I can probably take care of this. And then if it comes to a level that, we need some expert opinion, some expert advice, that's the time to refer, versus not knowing someone and someone just coming in for like really sick or having to go to the emergency room, where we really raise our costs. That's where the healthcare costs really go up. And our aim, our goal probably is not probably our goal is to keep patients away from our emergency rooms if we can. Like, that's what we work towards. Providing the care, providing optimal care at the clinic level, using our resources in terms of our nurses, our social workers, our partners in behavioral health, like all of it together to kind of prevent something really accelerating into a crisis and making someone have to go to the ER. That's what we work towards.
Could you talk about hospitalists? Years ago, when I worked in a hospital, family doctors followed their patients in the hospital. That is not done anymore. So that there is a disconnect, from my point of view, as a consumer, between my family physician, who knows me very well, And if I end up in the hospital with someone who doesn't know me from Adam or Eve or whatever you want to say, and you may not have the same hospitalist during your whole stay, so there's even further disconnect.
And I know,
And
sorry.
then, what happens when I go home? Who is going to write the follow-up care? And how is that message going to go back to the dear soul that I love dearly, who's been taking care of me for so many years, who knows me so well, and has orders that make no sense to him because he knows me, but the person who wrote them doesn't?
I hear your frustration, and this is something like we have heard from many like different people, and this is actually one of our passions. This is what we are trying to improve. So we at the Right Center, so first let's go into why did we as primary care providers decide as a group that we are not really going to go into hospital medicine, and we have our team of friends taking care of people at the hospital. Why did this happen? One of the big challenges was you have patients scheduled at your clinic that you are going to see. You have so-and-so scheduled to come and see you at 9 o'clock, so-and-so scheduled to come and see you at 9:30, at 10 o'clock. And you have one of your patients whom you have known forever, for the last 20, 30 years, going to the hospital. You really want to be there to be able to take care of that person. But what about the people who are already scheduled in your office to see you? Like, who are you going to actually favor? Let's put it that way, right? So that's why I believe medicine came up with the concept of a group of hospitalists taking care of people at the hospital and primary care physicians kind of staying in the office location. Not to say that we cannot make social visits and still visit our patients in the evening and make sure, like whatever we know, like that's appropriate or that's going on, what should happen, and have that one-to-one connection. Another way we are trying to make it happen is we at the Right Center, we have access to all our patient chart, and whenever we decide to send one of our patients to the hospital or we get a call, I'm really sick, I think I should be in the emergency room. Obviously, our first response is, what's going on? Can we see you at the clinic? And then maybe make a decision. Maybe we can take care of you here if that's feasible. If not, if they do happen to go to the hospital, we do try to make it easier in the sense that, yes, this person, so-and-so, really should be in the hospital to get this test done or get this checked. We try to get them a hospital bed so that there is no waiting time in the emergency room. We have our team of our own doctors in the hospital who we connect to, we talk to them at several different levels. Our nurses call them, our residents talk to the residents in-house at the hospital to kind of what we call sign out the patient, tell them what's going on. And on a physician level, I would call my colleague who is the hospitalist there to say, so-and-so is going to the hospital, this is what I'm thinking, please can you take a look and give me a call back and give me a feedback. So we are in touch all the time. We have our nurse managers, as we call them, call on the patient every day to check with the physician who's taking care of the patient and also with the patient per se or with one of the family members to make sure their needs are being met. And when it's kind of time for discharge, it is appropriate for the person to go home. Do they need to be maybe at a different level of care? Like a step down care and then maybe transition to home. How can we make that happen? What are the discharge medications? What are the discharge instructions? Was there something my patient was taking at home that was kind of stopped temporarily at the hospital? Should they be back on that? How do we kind of reconcile our medications, as we call it, the medication reconciliation part of it, to make sure they are not on 3 different kinds of medication, one prescribed here, one prescribed there, like all the mismatch. What are the labs, what is the blood work that we need to check maybe in a day after discharge or 3 days after discharge? So we are really working very hard to integrate the system, and I think we have made a measurable amount of success, but there is much more we can do about it. So if that answers your question. Yeah.
Thank you so much. I think she deserves another round, don't you think? Thank you so much, Dr. Barua. And to your wonderful children that were very attentive to everything she was saying. So the special gifts do not end here. We have a wonderful surprise for all of you. Can we give a real warm applause to welcome the Scranton High Night Rhythms that have come to give you some joy.
My country 'tis of thee, sweet land of liberty, of thee I sing.
Land where my fathers died, land of the Pilgrim's Pride.
From every mountainside let freedom ring, let freedom ring for America, let freedom ring through our song, let freedom ring in our hearts, let love abide. Of thee I sing, let freedom ring. Let music swell the breeze and ring from all the trees, sweet freedom song.
Let mortal tongues awake,
Let all that breathe partake, let rocks their silence break, the sound prolong. Let freedom ring for America, let freedom ring through our song, let freedom ring in our hearts, let love abide. Of thee I sing, let freedom ring. times of misfortune, I'll be there to hold your hand. I'll be there to share the burden, and together we will stand. We will stand with you, no matter what you are going through. If there is ever anything that we can do, we will stand with you. Now is time for all children everywhere across the globe to convey our fervent message, sent with love and filled with hope. We will stand with you, no matter what you are going through. If there is ever anything that we can do, we will stand with you. We will stand with you, no matter what you are going through. If there is ever anything that we can do, we will stand, we will stand, we will stand with you.
How about that? Come on, let's hear it.
Diversity in voices, unity in message. What an appropriate ending to a wonderful evening. Before we say goodbye, I'd like to call on Kate Holland, who has to do some very important thank yous.
Thank you. Thank you, everyone. I always get tears in my eyes when I hear that group. They're just phenomenal, aren't they? Oh.
How about that?
We're thanking ourselves. I'm Kate Holland, and I'm the chairperson of the Interdependence Day Committee. And there are a lot of people to thank to make this evening so successful. First, I'd like to thank the University of Scranton for hosting us tonight. This is our first time here. And it's a beautiful view of the city, and it's just a wonderful place to have our Interdependence Day event. I'd like to thank our speaker, Juby. Very good, very passionate, very informative. Our Mistress of Ceremonies, Ida Castro. Now, many of you got a program. On the back of your program are names of friends, sponsors, angels, patrons, media partners, and our host organization. These are all the people that participated to help make Interdependence Day a success as it is. So many thanks to all of them. Okay, then also, I want to thank Mark Migliori from our ECTV. Mark, when can we look to see this on? When can we look to see this? Tonight at 9 on ECTV. Okay, then we also there was a slideshow, if you noted when you came in earlier, that was put together by Beth Birkenhauser from the Hexagon Project, which is an offshoot of Interdependence Day. Beth honors Interdependence Day with a wonderful display of hexagons gathered from all over the world and the country, and they're on display right now in Steamtown at Steamworks. There's a whole collection of them, so you can go to see them. I would like to also thank our founder and our inspiration, Sandra Myers. Thank you, all of you. I've seen some of you here in previous years. I know you've always enjoyed Interdependence Day, and I welcome all the new faces. Please enjoy yourself. There's some more food and refreshments at the reception, and thank you again for coming.
Hey, let's do a photo. Sandra, if you want to speak.
Oh, do you need?